Well, let me start by saying, we've made a lot of progress with heart disease, but ultimately we still have a long way to go. This is the #1 cause of death in the nation. But perhaps even more important is some of the real disparities we see between low-income people and people of color when it comes to heart disease. And I think we can do more to really address some of those factors. The preventive issues of heart disease are really mostly what we refer to as behavioral risk factors, health behaviors that we can change. The #1 cause of heart disease is tobacco use. We made enormous amounts of progress with that. It used to be that, in the 1950s, half the population smoked. Now we're down to about 1 in 10 adults smoke. So we've made progress, but we still have some more work to do there. The more challenging issue right now is obesity. Obesity is also a driver of many, heart disease and heart disease risk factors, and that's a risk factor. That's a problem that continues to go up in our society. And then one thing I'd like to focus on, though, is what we think of as medical risk factors, and those are things like cholesterol and high blood pressure. And right now, our team at ASTHO is really focused and interested in working on high blood pressure. Most people, if they live long enough, will develop some kind of high blood pressure. It's sort of part of aging, but many people develop high blood pressure when they're younger, and those people are particularly at high risk to then develop other forms of heart disease. And that's where I think there's a real opportunity to help people not develop high blood pressure at all, or, because for some people it's inevitable, really help those people bring their high blood pressure, or hypertension as we call it, under control. In public health, we follow the adage, make the healthy choice the easy choice. So, many of the health behaviors that people have are really a result of the environments that they live in. One issue that I think we're going to get to later in the interview is, some of the social issues that people have to deal with in their lives. And, if you're poor and if you have less access to healthy food or to a place to exercise, you're not going to be able to do those things as easily. Tobacco, smoking, is a great example. We have an industry that markets tobacco use to children. Most people start smoking when they're children. Keep that in mind. So, these are all things that are working against people. I think most people want to live long and healthy lives, but they face a lot of challenges to making those kinds of behavior changes. Social determinants of health, as we call them, these are things like income. Are you poor? Education. People who are better educated always do much better. We often think of access to health care as a social determinant. If you don't have good access to health care, it's very difficult to stay healthy. Things like housing, access to food, access to places you can be physically active. These are all social determinants, and many people face a lot more barriers and challenges to having access to these things compared to others. But the other thing that's very interesting in some of the research around heart disease is this issue of what's the long-standing effect of things like racism and discrimination on people of color. There's a lot of research that started to show that people who've over and over again faced racism, discrimination, unfair working practices, that takes a toll on you. That takes a toll on you sort of in stress and in your ability to sort of tolerate those conditions. And those kinds of things, we believe, lead to conditions like hypertension, which ultimately lead to conditions like heart disease. So, the more we can deal with some of these underlying social conditions and conditions of fairness and equity, the better we're going to do with many of the chronic disease concerns that we face, particularly heart disease. We're increasingly seeing a lot of success around obesity, and particularly the risk factors for obesity, those being diet and physical activity. And a lot of states have looked at ways of, if you want people to be physically active, can you make parks more accessible? Can you find ways to make other facilities, open up schools in the evening so that people can use those facilities to get out and exercise? Make sure that neighborhoods are safe and well lit so that people feel comfortable getting out and moving around. Those things make a huge difference in driving people to do activities that many of them want to do. Same thing with diet. I mean, it's much easier to have a healthy diet if you have access to grocery stores that have a wide variety of healthy foods like fresh fruits and vegetables. But many people in low-income communities don't. So what many states and local communities are doing is trying to really push to increase access to healthy foods in communities that have traditionally not had access to those things. And then I think that I mentioned earlier, I think the new place we're trying to make some headway is around high blood pressure and really, identifying people who have high blood pressure, finding ways to help them manage that condition. Part of managing that is through medical care, and so we need to have them have good access to medical care. Part of that, though, is support in their community and greater sort of understanding of why this is important and why you have to make changes or take medications to get that under control. And oftentimes we work at the community level just to, bring that information to people and increase education and overall literacy or understanding of these issues. I think state health departments are just starting to get into this work of these so-called secondary risk factors like high blood pressure and high cholesterol. I think there's an enormous amount of potential there. So that's a tough question. For me, it's a tie. I mean, I've worked most of my career around tobacco control, trying to find ways to lower the rates of tobacco use in this country. It's such a potent risk factor for heart disease and for cancer, and we have really good interventions to lower the rates. So, I have to mention that. But what I'd like to focus on for this question is this thing we talked about earlier of social determinants. We have got to find ways to address some of these social factors that play such a profound role in determining people's health, not just around heart disease, but around really anything. So we've got to look at ways to make income more fair in this nation and, give people opportunities to really move up into better paying jobs and jobs where they can have a better overall quality of life. We've got to pay attention to things like education, which, plays a profound effect across all those things, housing, access to medical care. But the other thing when we're talking about heart disease is we've got to take a deeper dive into some of these broad health equity issues. And we've got, in our country, we have this long-standing legacy of racism, which has had a profound effect on the people who've been affected by it. And then even current day discriminatory practices, discrimination in places like work sites, that's where people spend most of their time. And if that site is discriminatory and a negative, stressful experience for them, those kinds of experiences we know now lead to things like high blood pressure, which ultimately leads to heart disease. So I think our society is beginning to really try to address some of these factors. I think our experience with the COVID pandemic and the profound inequities we've seen with that have really gotten everybody thinking about the fact that we can't continue to live together this way. And so I'm hoping we'll continue to see some improvements in those kinds of things. And that will ultimately make the difference in the disparities we're seeing. We need to lower heart disease rates overall, but we have got to diminish this huge difference between the outcomes for heart disease for white people and the outcomes of heart disease for people of a wide range of other races and ethnicities. And I think the only way we're going to do that is not focusing on people's individual decisions and behaviors. It's really focusing on the big picture societal issues that are driving a lot of this illness.